Hey listeners, this episode contains descriptions of violence, police brutality, self-harm, and mental illness. Listener discretion is advised. In 2021, something big happened in Minnesota. The state legislature passed a landmark piece of legislation known as Travis's Law.
And Travis's Law was named after a young man named Travis Jordan, who was killed by Minneapolis police.
That's Michelle Gross, the Minneapolis activist who wrote the law. Travis Jordan was shot and killed by police when he was in the middle of a mental health crisis. At the time, in Minnesota, if you wanted a mental health crisis responder, you needed to call a specific phone number. It varied county by county, and it was not 911.
We do have mental health crisis response teams in all 87 counties of this state. They were just being underutilized because people had to know the magic number. You know, in each county had their own number.
Travis's Law changed that. The law made it a requirement for 911 dispatchers to send calls about mental health crises to a specially trained team of mental health responders. Just getting Travis's Law passed in the first place was a huge undertaking.
I'd always known this was a problem, but I looked at that and I said, we can't have this anymore. That's just too wrong. We need to address this connection between mental health and police. We've got to break that connection.
Michelle runs Communities United Against Police Brutality, or CUAPB. It's an organization dedicated to supporting victims of police brutality, and often their families too. And she knew this wasn't an isolated incident.
The job of police is to investigate for the existence of a crime, who might be involved in that crime, and gather evidence for those people's prosecution. That's the job of the police, and we don't dispute that job. That's fine. But mental health crises, those are people with an illness. And we formed a mental health work group because we do all of our work through work groups. And we spent about 8 months researching the issue.
From there, they wrote a bill that requires 911 call centers to dispatch mental health crisis responders when those calls come in. Michelle and her team took the bill to the State House.
And they initially saw this bill as being sort of an anti-law enforcement bill.
Legislators on both sides of the aisle weren't convinced. But Michelle and her team kept up the work.
And we had Flo Ching, the mother of Travis Jordan, testify multiple times at committees about the need for this bill and what happened to her son. We also had mental health professionals and practitioners testifying about it. And we tried really hard to help them understand that it was actually helpful to law enforcement because they didn't have to place their resources into calls that were very lengthy.
Their work paid off. The bill gained momentum.
It got lumped into what's called an omnibus bill, which is like, we're running out of time, so we're just going to lump all the bills together. But we squeaked it through.
Travis's Law was passed.
And that's saying something because rarely do bills pass on the first go.
It felt like a major win. In the wake of so many deaths, Communities United Against Police Brutality had mobilized to provide a real solution, one that would save lives. But the work doesn't stop when a law is passed. Change doesn't happen overnight. Even after Travis's Law was passed, people in Minnesota still don't necessarily get the responses they need, the responses that they have a right to when they call 911.
I personally, I'm convinced if the state laws had been followed, and all of those times that we called to ask for help, crisis response team had been there, Brent would be here with us.
In partnership with Act Blue, this is Build the Change, a show about the people at the center of progress. I'm your host, Alok Vadmenon. I'm an author, poet, actor, and advocate, and your companion for this trip around the country. We're in search of the most compelling causes and stories from the candidates, activists, and everyday people driving them forward. In this episode, we're talking about the people fighting for better access to mental health resources. We're zooming in on the story of how families and organizations in Minnesota and around the country are teaming up to ensure that their communities are safe and supported during mental health crises. Real change takes sustained engagement, and that takes a movement. At CUAPB, Michelle Gross works directly and intentionally with victims of police brutality and their families.
So we run a 24-hour hotline. We refer people to lawyers. We help people investigate their own cases. We go to court with people. We pretty much do what people need to help them get legs under them after a bad incident, after an incident with the police.
And when people are looking for help, it's not just a one-time engagement.
We're about social justice, not social services. So if people want our help, they actually have to come to our meetings.
In the Twin Cities, one of those families Michelle has worked with is the family of Tara and Jay Sykes.
Jay and I are a blended family. We've been together for 20 years.
3 boys.
3 girls. We call ourselves the Brady Bunch.
From a sibling standpoint, yeah, we're all really, really close.
That's Stacia, Brent's sister.
Brent's the oldest, and he's like the leader of the bunch. You know, he helped raise us, as we like to say.
In 2011, Brent was in his early 20s, and he'd also started struggling with his mental health.
Man, as a mom, you know when something's wrong with your kid. And I just knew there was something not right. He shut us all out, and we were just fearful that he was going to hurt himself. He was such a sweet, giving young man, but he would harm himself.
One day, Tara was especially concerned for Brent's safety. She found out he had hurt himself, and she was trying to figure out what to do.
I just happened to be at the clinic for another appointment. I think it was with one of the other kids, and they had these little flyers there.
The flyer had a number for a mental health crisis hotline. She dialed and told the operator about the situation.
And that was enough for them to send us a crisis team to our home.
We didn't even know, we had no idea what a crisis response team was.
Right.
It was the family's first encounter with a crisis team, and it made a big impact.
They just talked to him, let him express, but they were trained. It was very obvious that they knew what they were doing, how they were doing it. One stayed and talked with Brent, and the other one came to us and basically said, yeah, you guys, there's something mentally going on here. That's some type of illness.
One of them went and called for EMT and police backup. And they came in, convinced Brent to go to the hospital. And from there, he was diagnosed bipolar schizoaffective.
This was back in 2011, about a decade before Travis's law was passed. The experience showed Brent's family that if they called for help, trained mental health professionals would come. After Brent's diagnosis, he was able to get additional support. He continued to live and work independently. But managing mental illness is rarely linear.
There's never going to be something that you just take this pill every day and it controls it. It doesn't work like that. It's not like controlling your blood pressure.
So Tara and Jay took comfort in knowing they could call the hotline for help. Then Brent moved to a more rural county in 2015. Now he lived more than an hour's drive away from the rest of his family. With the onset of the COVID-19 pandemic and the death of his biological father, Brent started struggling. Tara called the hotline again. She told them the same thing. Her son was hurting himself, and she needed someone to check in on him. Instead, she was told that the hotline didn't serve his new zip code. Here's how Brent's sister, Stacia, remembers it.
And they told us that there was no crisis team available in that county. And so, correct me if I'm wrong, we tried for another county and they told us they could not cross county lines.
Correct.
Right.
Tara was panicked. She was more than an hour away. Brent was refusing her calls, and she wanted someone, a professional, to check in on him ASAP. So she dialed 911. She told the dispatcher that her son was having a mental health crisis. Under Travis's law, the dispatcher was supposed to offer a crisis response team with mental health professionals trained to respond to these kinds of situations. They may also offer police or EMTs as they see fit. Instead, the dispatcher only offered to send a police officer to check on Brent. She wasn't sure what else to do. While she began the hour-long drive, a local officer checked on Brent. He called Tara and reported that Brent had answered the door. Tara was relieved and continued the drive. Brent had calmed down by the time she arrived. But over the coming weeks, they repeated the cycle a few more times. Brent's family placed around 8 911 calls between September and December of 2022. Each time, they would explain that their son was experiencing a mental health crisis, and each time, the dispatcher would just send a local police officer. In December of 2022, Brent's family made one final call to 911. When the police showed up, things got worse. Brent was said to be holding a knife. The cops called in a SWAT team. The family tried to calm things down. Ultimately, Brent was shot and killed by the police officers. The Sibley County Sheriff's Office was not able to be reached for comment.
The worst part about this too is I was completely unaware that Travis's law existed until after Brent died. If I would have known that law existed, I would have lost my shit on Sibley County when I called and said, you need to send somebody. This is a law.
Brent's family was left to pick up the pieces. When they started speaking out, they met Michelle Gross. And then they realized that the resources that they had been asking for all along, they actually had a legal right to. Through Communities United Against Police Brutality, they realized they weren't alone in this fight. Other families across Minnesota were dealing with their own experiences with mental health and police.
My child didn't get killed, but at the same time, his livelihood, he's alive, but his livelihood is gone. So he's like living dead.
That's Claudia Sago. Like Tara, she has an adult son, Jomari, who faces significant mental health challenges.
It gives me a hard time a lot of times, but however, I love him anyway. He's a determined person, you know? Even against the odds, he still got this, I can do this, or I got this attitude, you know? And a lot of times I have to step back because I'm looking at him like, for real, you know? But however, he usually normally do show me that, you know, he's capable of doing what he say he can do.
With the onset of the pandemic, Jomari lost his job. He was also in the midst of a divorce. He went to the hospital to seek help, but before he got inside, he got into an altercation with police that left him permanently injured. Jomari had medical bills. He needed constant care, and he was facing criminal charges for the incident. Claudia wasn't sure where to turn.
I'm 75, and so I had no help. I had to do what I got to do.
And then a local librarian told her about the CUAPB. Claudia called the hotline and got in touch with Michelle.
And then she said her son's name. For some reason, I didn't make the connection that her son was a guy that had volunteered with us a few years before. And I said, oh my God, I cannot believe that this is the guy that volunteered with us before. And now he's been grievously injured by the Minneapolis police.
Michelle set Claudia and Jomari up with a lawyer. She's helping them navigate the charges against him and to seek justice. The case is ongoing. Michelle says her goal is to make sure victims and their families feel in control of the process.
We dissect the case and we start figuring out what needs to be done, but we get people involved in working on their own cases and working on other people's cases, because when a person is harmed by policing, it's a very disempowering experience. And so just giving people a bunch of services wouldn't help them regain their sense of personal agency. And that's what we do. We make sure that people regain their sense of power.
CUAPB is also creating a sense of community, which Claudia and Tara say has been hugely helpful.
It does help because I appreciate people listening, and it feels like a support group for me because I had no one. I didn't know what to do. I didn't know where to turn, and I was just running into dead ends.
Well, for me, it was just being connected with other families that are going through the exact same thing and that we're not alone.
And it builds more momentum for change. Victims, their families, and volunteers come together to talk through cases and rally support for policies. Now, Michelle, Tara, and Claudia are all among the people working to make sure Travis's law is enforced.
We've got another bill at the legislature that's going to put some teeth into Travis's law that basically is going to penalize the individuals who are in charge of 911 if they don't implement Travis's law appropriately, and we're going to put a state agency in charge of the implementation of Travis's law.
Which means anyone calling 911 to report a mental health crisis would be directed to access a mental health crisis team. And that, the families say, is what they want.
If I can get one individual with a mental health illness saved because they decided to send a crisis response team because they didn't want to repeat a Brent because they know what's going to happen to them, excellent. I've made a difference, but I'm not going to stop there. I have to keep going. I have to get justice for Brent and for so many others.
Along with a broader awareness about mental illness.
I'm really hoping that the way that they handle the mentally ill people will change. Come on, be human. And for other people who had went through this or have children that's going through this, to understand, be there no matter what, support, and understand that, they have their moments. We all have moments.
Even if you're not currently dealing with someone who might be, having a health issue or something like that, helping to end the stigma just by learning more about it, you're making a difference. And you can have an impact on someone's life just by learning a little bit more.
Travis's law has the potential to create real change for communities across Minnesota and even be a model for other states. Laws to protect people in moments of crisis are just one piece of the puzzle. We also need more proactive care.
There's a story that I often tell of a participant of one of our trainings where she shares about how, for her mental health journey, she lived in the rural South.
That's Yolo Akili Robinson.
She had been diagnosed with bipolar, but her faith community told her that wasn't real. And for, I think, almost several years, she struggled with her condition and also didn't have support, largely because she was kind of taught to center her faith as opposed to centering medication and different kinds of care. And it wasn't until one day that she sat down with a stylist to get her hair done. And she shared with the stylist some of the challenges she was having. And her stylist was like, well, hold on, bipolar is real. And in that experience of her sitting down with her stylist, getting her hair done, feeling affirmed, and getting connected to care through her stylist, who was like, I know someone you can talk to. All of a sudden, she was in care and reportedly, sharing that how much that transformed her life.
Yolo founded the Black Emotional and Mental Health Collective in 2015. The national organization does training based on a model of peer support.
Recognizing the ways in which in many Black communities across the United States, the people who were often doing the frontline mental health work were often not social workers and therapists because they weren't available.
BEAM's goal is to spread information about mental health in local communities. And Yolo is focused on making sure Black Americans, who have often faced systemic challenges or barriers to accessing good care, are getting the care that they need.
So I think the first piece is to understand that this isn't about jumping into situations where we have no relationship, right? When we're talking about our work, it's where we're in relationship already with people, right?
Through a training program, BEAM equips community members who are already providing care to their peers with additional tools and gives them recommendations for other resources if someone is looking for a higher level of care. It's a model built on trust and reaching people where they already are. Plus, people in the training meet and share examples and resources.
By training communities on the ground across the United States with skills and tools and strategies to not only advocate for themselves but for their communities, to understand the broader landscape of mental health and what's happening in their communities, and develop a collective movement to really push forward policy and strategies. So the training is really about creating those ecosystems of care.
To make real change, we need to be invested. And to be invested, we'll need support. This isn't something one person can do alone. Michelle Gross from Communities United Against Police Brutality has advice for others looking to get involved.
People who want to organize against police brutality in their own communities, I think that's wonderful. First of all, you're taking on a noble cause, but don't do it alone. This is not solo work. You need to do this with other people because A, it's hard work, B, it's safer for you to do it with other people, but you also need it because you need perspective. You need to know what other people have experienced at the hands of police. You need to understand what it looks like to be somebody that's different from you. As soon as you ask the question, 100 people will jump up and tell you that they've had that experience in your area, and you will be able to form a group and get some real work done.
Real change takes time, and the work doesn't stop after a law is passed, which is why we can't do it alone. Communities coming together to push for what's right is what makes a movement, and that's what gives me hope. Whether it's supporting organizations like these, mobilizing your own community, or even starting fundraisers of your own, Act Blue has the tools and resources to help. You can learn more about the organizations featured today: Communities United Against Police Brutality, BEAM, and more at actblue.com/build the change. Build the Change is created in partnership with Act Blue, produced by Wonder Media Network, and hosted by me, Alok Vadmanet. Our production team includes Edie Allard, Lindsay Cradowell, Sarah Schleet, Abby Delk, Hannah Bottom, and Paloma Moreno Jimenez. Our executive producer is Jenny Kaplan. Our showrunners are Rohida Javangula and Maria Jose Hurtado. See you next time.
Democracy is hanging on by a thread, and misinformation is everywhere. I'm a political analyst and columnist, Danielle Moody.
And I'm writer Wajahat Ali, and we've come together to lead you away from the lies and out of the gaslight. This is Democracy-ish.
Black and brown people already knew that there were multiple levels to our justice system, to our injustice system.
And I think those of us who are willing to be nimble and flexible and stretch into being something new, I think we will be the ones who might emerge in a healthier, better way moving forward.
We discuss the serious issues and threats that face our nation. Join us on Democracy-ish everywhere you get your podcasts.